A year ago, the epidemic was just a matter of tension that we watch in movies. People who liked this would research and watch the most realistic.
집을 떠나고 있습니다.
시민들의 불안 심리를 잠재우기는 쉽지 않아 보입니다.
모든 병원에서 유사환자가 접수됐답니다.
hun방마취의 특징입니다. 사망한 주병의 증상과 완전히 일치합니다.
However, no one could have guessed that these films they loved to watch would one day become real. The virus occurs in China, started to spread around the world. After transmission of the disease, the World Health Organization officially declaring coronavirus as a pandemic. And our lives began to resemble those in movies.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
After this day, we have started to hear the name of this virus much more now. So what is this coronavirus? According to the World Health Organization, coronavirus disease, COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people, and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. The most common symptoms of this disease are dry cough in most people, fever fatigue, mucus production, sore throat, muscle pain, shortness of breath, loss of smell and taste, and aches and pains. To prevent infection and to slow transmission of COVID-19, do the following. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rub. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and staying away from large groups of people. Of course, the measures shouldn't have been limited to this, and they didn't. In many countries, serious measures such as curfews have been taken by governments. Of course, there were those who found it unnecessary to take precautions.
No meu caso particular, pelo meu histórico de atleta, caso fosse contaminado pelo vírus, não precisaria me preocupar. Nada sentiria ou seria, quando muito, acometido de uma gripezinha ou resfriadinho. Uma gripezinha ou resfriadinho.
They also became corona. Maybe they easily survived, but the citizens weren't so lucky. Numerous people died in their country. In countries where measures were insufficient, even mass graves have dug. In most countries, in most cities, the streets remained in great silence. People were dying, they could not find a place in hospitals. They were waiting at home, desperately, away from their work, their schools, and their social life. People stockpiled food and drink in their homes because of the possibility of not be available for a long time. However, some of them did not have the money to buy them. Because, due to the virus, he lost his job. Some stayed away from their families, some from their homes. Others succumbed to the disease. In the world's most populous cities, people remained separate from the streets. Everyone waited on the streets for the days when they could return to their normal life. However, those days did not come. People wanted to support each other, at least psychologically. They found various solutions for this. After stringent measures were taken, most countries saw a large drop in the number of cases. Thus, restrictions were reduced so that life could return to a little normal. The new order was called the new normal. During the stringent measures, everyone was working from home. They just started going to work with their masks. People have tried to return to normal by maintaining social distance and wearing a mask. Transport has come to life again. Restaurants opened, but everything was different from order-to-table layout. The memory photographs taken on vacation were masked now. Students started to receive their education partially at their schools. Marriage celebrations, weddings were held again. However, the photographs of the bride, groom, and guests would also be masked. On the other hand, vaccination studies, which started from the moment the virus first appeared, continued. Everyone was eagerly awaiting the good news of the vaccine. As good news came from vaccines, cases were increasing again. Today, while many angle studies are continuing, people have started to be vaccinated with proven vaccines by successfully completing the third phase. However, after the return to life with the new normal order, cases started to increase again and faster. More and more people in the world are caught with this virus and die every day. Moreover, the rate of transmission is increasing due to the mutations that the virus has suffered. Until now, 88.2 million people have been infected with the virus in the world and 1.9 million of them have died. Still in the world, about 600,000 people are detected with the virus every day. The year 2020 was written in history as a year passed in the darkness of coronavirus in the world. Nobody knows what will happen in 2021.